Hello and welcome to the New City Podcast, where we exist to renew the Quad Cities by restoring the health of its people. I am Jarek Bakken, joined here by Dr. Alex Arguello and Dr. Sara Rausch. Wonderful intro here. Sara is the co-owner of Motherhood Matters Wellness here in Davenport. She's a chiropractor, a certified yoga instructor, a DNS Exercise Trainer, chiropractic acupuncturist, dang it, I'm not going to be able to pronounce that word, movement enthusiast, eternal learner, and a mother of three. Now correct me, Ashtanga?
Yeah, Ashtanga.
It's the A, not the I. What the heck is that?
So Ashtanga yoga is a very...
Okay, that's what I thought.
Yeah.
Okay.
Ashtanga.
So is that a descriptor of certified yoga instructor?
No, it's a style of yoga.
Oh, okay. So it's a separate thing. So it'd be like saying personal trainer versus...
Oh, it says Ashtangi.
Okay.
Yeah, I wasn't looking at it. Ashtangi means, like yoga.
Like a
yogi. Yes.
Now I got it.
Ashtanga is the style of yoga, and I'm a Ashtangi.
Ashtangi. Okay, I get it. That's quite the resume. So we want to talk today about kind of what all you do, what all got you there, and everything in between. Cool. So where does life start for a person that ends up with this kind of resume?
Well, that's interesting because it didn't start with any of those things.
Mm-hmm.
I'm actually a huge math nerd. I guess that should probably make it in there.
That's right.
Math nerd? Is that what you just said?
Okay.
Yeah. Like
yeah.
addition and subtraction and algebra and
yeah.
When I was 9, I wanted to work for NASA as a mathematician. That was my goal. But I'm from Madison, Wisconsin, and there's not a ton of opportunity to work for NASA
in Wisconsin.
in Wisconsin. Which, I could have moved, but I actually had a baby at 15 years old, which then makes moving to Florida rather challenging. So I decided that I would still pursue mathematics. Mm-hmm. Got my first degree, bachelor's degree in applied mathematics and computer science. Even though they tell you math will get you far and that you should learn math and it's really great, and I agree with all those things, you really can't get a job in mathematics.
Yeah.
And so I ended up in American Family working in their IT department, which the atmosphere was amazing, but the job was boring, and I did a lot of sitting in a cubicle, which was terrible.
Yeah.
So then I went back to school, and I decided I wanted to be an engineer. So I have another degree in civil and environmental engineering.
Nice.
As I was finishing that degree, I actually started having some strange health challenges. Felt like the right side of my body would kind of go numb or feel weird. And that's the first time I experienced chiropractic. I was in my early 20s. And from that point on, I had about a year left in my engineering degree. And I was like, I don't even really want to do engineering. I also at that time found out I was going to end up in a cubicle working on blueprints, and
right.
that sounded terrible.
Yeah.
So, and really, honestly, chiropractic is so much like civil engineering of the body. It really kind of works.
Yeah.
So.
Cool. Okay. So
a quick side note here. When I was an undergrad, I was going to be a biology major with a pre-dentistry focus. And just to kind of sum up my college experience, I didn't sign up for classes in time. So I had very few to pick from. So me and my friend went into the, whatever the office is called, where you pick classes. And I said, what's the easiest class that I could take? And me and my friend settled on computer science.
Oh my gosh.
And it ended up being the hardest class I
yes.
ever took.
It's so hard.
I got nothing from it. I was mad the whole time. So, yeah. I'm also not a mathematician or computer scientist. No. If that's even a thing. Is a computer scientist a thing?
Yeah, computer science.
Can you be a computer scientist? Is that a thing?
I don't really know if that's what they do.
I mean, you can make iPhones and stuff.
Usually like a programmer or
yeah, but there's still hardware. There's still hardware involved.
Yeah.
Basically, now the challenge is how do you make it smaller into a tiny device that's going to fit in your pocket?
C++, is that still a thing?
That's what you got?
That's so old.
That's
C++.
what I learned.
Yeah, it's object-oriented programming, and it's so hard. Like Java is the new.
Right.
And I was a football player, and she hated football players.
Oh, yeah.
Because I had to leave early for practice sometimes, and it was a bad experience.
So,
sorry, I just derailed everything.
First question, how long, this is a selfish question, how long were you in your first cubicle job before you realized this is going to eat me alive?
I think I was there maybe, I don't remember, a year.
Okay. That's not crazy.
No. I have low tolerance
Same.
for,
Yeah.
maybe that's a 3 thing.
Yeah.
I'd be like, no, this isn't going to work out.
Mm-hmm.
So.
Yeah. Okay. So your personal health experience, tell us more about that. What did you realize was not normal, and how did you end up in the also not normal, in quotes, route of seeing a chiropractor?
Well, so this is a little multifactorial. I think that most of my life I went through with moderate to severe body dysmorphia. Mm-hmm. I think that a lot of health is focused on weight. Mm-hmm. And we're looking at, health factors of generally being overweight. But I think there is this whole population of women who have extreme body dysmorphia. And
Sure.
it's how thin can I be?
Mm-hmm.
I don't think I've ever weighed over 140 pounds in my life. Mm-hmm. And it was always, how little can I eat? How much can I work out? How thin can I be? How small can my clothes be?
Sure.
And I would say that was probably true for me until the past 3 or 4 years, the majority of my life.
Yeah.
I did a little stint in anorexia when I was in middle school. And it was never severe. It was just seriously, how little can I survive on 2 saltines a day?
Sure.
So when we look at how thin people, we think, oh, healthy. And
sure.
That's so not the case.
Yeah.
And so that was much of my life.
Mm-hmm.
And then when I worked out, I did some weightlifting. I did some cardio. I did a ton of yoga. And it was all under the premise of how skinny can I get?
Sure.
And then having a baby at 15, I bounced back pretty quickly as far as I knew. I had a lot of interventions during that birth because I don't think we've ever done a great job of educating women in birth and pregnancy to begin with. But then when you're 15, people don't think that you can handle that, or it's it almost felt like a punishment, and
sure.
We're just going to do this to you because you've done this to yourself.
Sure.
And so I had some pelvic floor things come up that I didn't know about. Nobody checked me for, that actually ended up worsening. So I was dealing with that. I had some diastasis. I just had a lot of health complications. The incident that happened when I was 20, until that point, I was like, gosh, I'm so healthy. I had no pain, nothing. And then just all of a sudden, this weird right-sided body thing. It turns out I have an unstable atlas. It's always atlas. It's frustrating. But even though I could get chiropractic to fix that, it had to be fixed 2 times a week in order for me to function. It would give me huge anxiety. I'd get weird fishbowl feelings.
Yeah.
I just couldn't function well without that constant chiropractic care. And I'm like, there has to be something else.
Yeah.
I think chiropractic is amazing. But that's all mobility. It's putting motion back into joints. Mm-hmm. But if you have an over mobile joint or something that isn't stabilized well so that it can move all the time. So I just started looking and seeing what else is there. So I started just taking seminars and, taking FMS, taking SFMA, taking DNS, doing all the things. And then really just learned from there that when you meld the two, it really starts to bring everything home.
Yeah.
And through that, then got into, looking at CrossFit because it is such a functional, movement thing.
Yeah.
And we are here to stabilize and we are here to mobilize and we're here to make everybody move as a optimal human.
So where did you go from, where did you see difference in I have to get adjusted 2 times a week to, okay, now I've like begun to create some change in a bigger picture to where I don't need 2 adjustments a week. What did that look like?
I'm still in that process.
Okay.
Very rarely do I need to be adjusted 2 times a
Sure.
week. Now I more enjoy being adjusted
Sure.
once a week.
Yeah.
But if I'd miss an adjustment, it's like not like I'm going to pay for that. It's, oh, that sucks, but
Yeah.
I'll survive.
Sure.
But I would say that has only been in the past couple years because that has been like when my journey of stabilization really started. Like I really like, even though I'd taken some DNS and I had started taking these seminars, like until I really owned it and started integrating it. And I would say that has been in the last 2 years.
Sure.
And especially after my last birth. So I had a C-section my middle baby. She was a foot-length breech with cord prolapse, so unavoidable. And then I had a VBAC, not knowing that I already had the pelvic floor dysfunction with the first. Then with the third, it worsened. And that caused me a lot of problems. And I realized I really needed to start addressing my core and pelvic floor in a major way.
Sure.
And so then that's where my learning all went. And that has actually helped everything.
Yeah.
Then.
So can you put flesh on caused a lot of problems for somebody who might not even know what like that means?
Yeah.
Might not even know what's not normal.
Yeah.
Right?
Yeah. Yeah, because I had no idea. So for me, it was prolapse. Prolapse is just a hernia of the pelvic floor instead of a hernia of the abdominal wall. And basically, they're still doing a lot of studying on it. I'm still doing a lot of learning on it. But it seems like the big majority of it is a hormonal component along with core dysfunction. So putting pressure down into the pelvic floor that is like of aberrant forces. And so then when you combine the two, it happens pretty frequently during, pushing a baby out during delivery. And if it's small, it can be healable. But the problem is that we're always in an upright position. And so we're always putting the force down into the pelvic floor. So it can be really challenging. And then it can be worsened by running and jumping and like pushing down into the pelvic floor with lifting and all of those things. So at that point, it's more of like a preventing it from getting worse than so much healing. But we see, it doesn't even have to be prolapse. Incontinence, diastasis, which is a separation of the abdominal wall, pain with intercourse, pain with tampon insertion, tailbone pain. There's just so many things that come up. I fortunately haven't had a ton of that, just the structural stuff, I guess.
Sure. So. Yeah. Basically, if something hurts, if something doesn't feel stable, like you're not just weird.
Yeah.
Right?
Yeah.
Like something's probably wrong.
Yeah.
Yeah. So how, it seems like your personal experience has been tracking really close to your professional experience, right? Like how the personal experience definitely led to the professional experience, but I know that, besides just doing this stuff for yourself, we'll get into kind of what you are currently doing now, but it seems like doing a lot and helping others simultaneously as you're figuring stuff out for yourself. Is that true?
Yeah, I would say so.
So what does that look like, and how's that kind of developed into a picture of what you do currently?
I guess when I was going through Palmer, if you had said you're going to own a practice called Motherhood Matters and you're going to really geek out on helping women in pregnancy and postpartum, I'd be like,
sure,
you're weird. And it was really with the birth of my last 2 children, just really starting to educate myself and taking birth classes and doing all the research and whatever. And just finding that even at 32 or whatever I was still not given the information. I had to go look for it. I had to do my own informed consent. And then finding people to support that is difficult. Like, we have a great support system in the community, but finding that is a challenge, especially when, like, it's not like even your provider is going to be like, doulas are a great option. They don't say that.
Sure.
If you have one, great. But they're not going to say, like, it would be a really great idea. What are your goals with this pregnancy and delivery? You know, if it's to have a natural birth without medication, they're not like, well, maybe you should consider a doula and you should take a birth class. And this is, you know, a great one to help you with that and whatever. It's just not very forthcoming. And so, like, through that experience and then seeing how postpartum goes and that there really isn't care. Like, I thought I had some hormonal stuff going on after my third baby. Go to my primary care physician. Well, we can give you a pill. They're like, well, I'm not birth control deficient. That is not exactly what I was looking for. Like, there was no discussion about, like, my hormones or anything. It was just, we could give you a pill. And so they're just, the resources are frustrating. And so, or finding the resources and feeling supported.
Yeah, for sure. So
then we decided we were going to create that.
Yeah, so paint us a picture of what you do now.
So I own a practice called Motherhood Matters, or co-own with Susan McLuhan. Mm-hmm. She is a doula. I am a chiropractor. And then I do all the things that you also said.
Sure.
And all of it is in supporting women and families to make decisions that are best for themselves. We, like, even though I just said, like, having a natural birth and all the things, I have had somebody come into the office who had a C-section with their first baby and loved it. Like, thought it was the best thing ever. And if she had had a second baby, that's what she would have just signed up for it the day she went to her first prenatal visit. And it's not our job to, like, convince her that that's not the best thing. That was the best thing for her. So we just want to support women and families in making the best decisions for themselves. And then supporting them through those decisions. Like, if you choose a C-section, we should maybe think about scar tissue work. Thinking about, you know, what's going to happen for you in the postpartum. Like, are you going to have proper nutrition, like somebody to care for you, to bring you good meals?
Sure.
Or are you just going to be scrounging because it's, you know, so just starting to look at some of those things.
Yeah.
So a lot of my practice, I obviously adjust, but I like to put in just about everybody gets something functional. Usually we start with breath. I have like a squat rack and a trainer bar, baby bar. And we just really groove movements that everybody makes on an everyday basis. So like we had talked before we started, that CrossFit gets this like connotation of throw a lot of weight around and do all these crazy things, but everybody in life all day long does CrossFit. Yeah. So it's training people when you're going to pick up your baby off the ground. Can we hip hinge to do that?
Yep.
Can you deadlift your baby? If you're going to carry your 17 bags of groceries in from Target, can you farmer carry them? You know, so we're just training people to do CrossFit in their daily lives, I guess.
Yeah, love it. Love it. Didn't even have to say it. Cool. So, like, I know you've talked about this previously. The name Motherhood Matters, like, I think immediately people think like, oh, pregnant moms or postpartum moms or whatever. But like, you're really adamant about like, no. Like, you had a baby at some point. Like, this conversation is still relevant, right?
It's totally relevant.
What is it?
Postpartum is forever.
Sure. Yeah. So like, tell me more about like that idea. Like, even if somebody had a baby however many years ago, right? Like, this is potentially still a relevant conversation for them, right?
Yeah, I would say that we are just starting to have the postpartum conversation. It has always been, you go in for a 6-week checkup, they do almost nothing.
Sure.
You're clear to do whatever. And now it's starting to change. But we started looking at mental health. We're starting to ask, the questions. moms are becoming more aware that there's pelvic floor issues. And we have like now 4 or 5 pelvic floor PTs in the area that, we refer to.
Sure.
I think that just everybody is starting to get more educated in the whole area.
Yeah. What's your vision for your practice in your office?
Oh, my vision for my practice is that every woman and family feels supported and educated and empowered in not only their birth, but their lives.
Sure. Cool. Sweet. You got more on her story before I ask some of those questions?
Well, I guess just listening to you talk, I was interested. You said that there was this physical component, of course, of just pressure, right? But then you also said that there was this hormonal piece to it. I was just wondering if you could speak to that a little bit, because I think that I think people have an understanding that during pregnancy, there's something different about hormones, but there's very little understanding of maybe what that can do to you postpartum.
Yeah.
So yeah, anything to add on that?
I mean, so definitely probably the one that most people have heard is relaxin. And that's still very present in the postpartum. And you still just have this really big balance of, if you're nursing, prolactin is going and progesterone and estrogen are still kind of balancing. And we even see it like throughout a normal cycle, like a normal menstrual cycle that, like with prolapse, at some point in your cycle, you may feel the symptoms, and then other times you don't feel the symptoms. And so just the fluctuation within there, women cycling 28 days, and then in the postpartum, it's still trying to regulate. And I mean, it can take up to a year for a woman to, and I would say a woman who is like kind of trying to really get back to, like normal. Yeah. The new normal.
Sure.
Yeah. So we don't like looking at 6 weeks. We like looking at a full year, letting the body, normalize the hormones and filling in physical components. And
so we have, like our kind of how we teach people about health, our principles of health is kind of this just like big picture overview of what we understand to be like kind of the optimal way for the human being to live, right? So looking at that year postpartum, like how much have you noticed about when, so you said this is a person who is focused on doing this, a year is probably a good window to look at. For somebody who doesn't have regard for kind of the stuff that we teach through our principles of health, who, isn't really paying attention to what they're eating, isn't moving, has kind of all this other just like stressful load on the body, like how have you seen the picture of not just 6 months, not just a year, like how does that change if like you're really kind of completely, just oblivious, right, to like the reality of our normal state of health?
Yeah, and I know that there is some obliviousness to it, but I would also argue that in our society that mothers are supposed to be givers, or like that's like we get a lot of mom guilt if we take time for ourselves.
Sure. Okay.
So I find that that's a bigger component.
Sure.
Like, I should be at home cleaning my house or doing whatever instead of going to the gym.
Sure.
I mean, I've found myself in those places where I'm doing everything for everyone else and I put myself on hold.
Sure.
So, I mean, that can go on forever. I mean, if there isn't some intervention and there's another way, you can care for yourself and care for your family. And it would be really awesome if you did those things together, Yeah. Every single time I come here, my 2 children sit and watch me work out. And many times want to join in the fun, they want to play on the rings. They want to do whatever. And I see, Alex's kids are here and your kids are here. And, it just normalizing that, so that they grow up and they know we take care of ourselves.
Yeah, that's interesting because it's like, on one hand, we greatly value service of other people, right?
Yeah.
But like, there's this major component of if you are not healthy enough to do that, you're actually going to harm yourself by thinking you've got what it takes to just take care of everything, right?
Yeah.
It's like the biblical principle of, you can't focus on the speck in somebody else's eye when you've got a plank in your own, right? Like there's an aspect of like, we need to understand that no, you're not the hero here. You can't do all this stuff. You actually do need to take care of yourself to be able to even do those things better, right? Yeah, that's huge. Even if we do know what it takes to be healthy.
Yeah,
right?
You still have to make a conscious decision to.
Yeah.
So I would say there's many women who are walking around with 15-year-olds who are still.
Sure.
Especially not physically, like we don't even, like nobody even checks people for diastasis. I check everybody. I know you guys are starting to check people or see it,
Right.
And then being told, or, people don't generally get checked. Is prophylactically, is that the right word? For prolapse, you have to like go in with symptoms and say, and then they check. And so it would just be nice if we were doing this like full thing so that people could care for themselves and know that they need, talking to.
Sure. Yeah.
One of the, I think it was today about emotions. When I went into my last postpartum visit, it's a form they give you where you circle 1 through 4 or something like that. And it's like supposed to pull out whether you have postpartum depression or whatever.
Yeah.
And like it might, but I know what you're looking for, and it feels hard. And some women go through such bad postpartum depression that it may be like, I shouldn't pick up my baby. I might kill my baby, like really intense things. But if I tell you that, I don't want you to take my baby away or think I'm a bad mom or something like that. So then we just suffer in silence. So in our office, like we don't have any forms like that. I just have a new mom come in and I say, how are you doing toe to toe?
Yeah.
And I say those exact things, like sometimes women feel like they might kill their baby and then they're afraid to get them taken away and like normalize that.
Right.
Because it's like 1 in 7 women that are suffering with those things. So.
Sure. Yeah, that's huge.
Part of the reason that I love that y'all talk about that. Like normalizing it,
Yeah, it's great. I told Tanner he won this morning because at 5 a.m. people show up at the gym and they get asked about their emotional state, and I told him he was the hero for making all these grown adults talk about their feelings.
Pardon the interruption, but if you're a mom and you have a body that moves, you need to check out Sara's Functional Movement Foundations class at Motherhood Matters. Right now, she's offering the class on Sunday mornings at 10, as well as Mondays at 12:30. And if you're interested in getting back into the gym, we would love to help you do that safely, taking your individual needs into account. We'll meet you where you're at and help you reach your goals. To schedule a time to talk to one of our coaches, just go to newcity.fitness/start. And for the record, what Sara does and what we do, it's not just a mom thing. It's a human thing, just to be clear.
Oh, that's good.
So I would want to know, like, if you've thought about this at all. So when we think about these principles of health that we've come up with, we would make the argument that even if everybody in the world was perfectly healthy, that these principles would still apply. But they also come from a reaction to how poor our health is. So people are in a state of health, and we would say, okay, well, let's first look at just what does it look like for a human being to be healthy, and then we kind of have this measurement. This is kind of what normal is, and we've kind of lost what normal is. So that's what we're trying to bring people back to. But when you think about that and apply it to what you do, I guess I'm just thinking about women have been having babies for thousands of years. And women have been having multiple, and they used to have a lot more than they have now.
Yeah.
And there was never a doctor involved, thousands of years ago. And there was never just kind of all these interventions that you were talking about. And of course, some of those are necessary, and we're thankful that they've come to be. But like, what is maybe some things that you feel like have happened that have led to now there's so many women who experience this depression after a pregnancy, or they experience the problems physically, pelvic floor issues and all those things? Because yes, I think some of that can just be part of normal life, but there also seems to be something that's just happened in our world that's led to this happening more often than I would say it used to. And I can't necessarily point to studies that say, hey, thousands of years ago, women didn't deal with this stuff, but it just, there was never talk about it. So you would assume that it wasn't happening.
I think it's just a cumulative effect of we sit in chairs from 5 years old until 18 years old, and then we go get a desk job and we sit in our desk jobs. And so we're already at a core dysfunction for like physical things.
Yeah.
We stop lifting appropriately because we're sitting in or so much. And we
so you would say if you want to be healthy during pregnancy and after pregnancy, you shouldn't sit so much in preparation for that. Is that what you're saying?
I would absolutely say that. I'm just giving
examples. Is that not taught in health
but,
class at schools?
I know, right? No, in health class while you're sitting in your chair.
Right.
Yeah. And I see 2-year-olds drinking soda pop when I go out. And I see if we want, like in 1,000 years ago or whatever, like we weren't seeing those things.
Mm-hmm. Yeah.
Women were squatting to like sit and, make things. And we weren't sitting in front of TVs, and we were out working in the fields and deadlifting and, doing all the things and eating from the land and not eating McDonald's. And so, and then we went and medicalized birth. That seems like, like you said, interventions are fabulous when you have a foot-length breech with cord prolapse.
Right.
I'm very grateful for the C-section, even though I didn't want it.
Yeah.
Right.
But then, like, when you're giving birth, you need to be in your primal brain. Nothing about a hospital screams primal to me. And so we just mess it all up. We put women on their backs and put their legs up by their ears. And that's not a good, I mean, you guys know about core function. It's not a good stabilized core where you can push effectively. And so. Yeah.
So combination of industrialized living and medicalization. Sounds like that's pretty familiar.
Yeah.
What we talk about.
So it is fun, like when you're raising kids with already like kind of having this, young kids especially, because you can like try to avoid having those things. For our family, we've decided that we're not going to send them to school because I don't want them to sit in a desk for 8 hours a day. And I know that's not feasible for everybody, and no judgment from me, but like if that is a reality in their lives, what are they doing outside of school?
Right.
It's hard to control their food intake in a public school. And so like, how are you optimizing it? And then how are you optimizing it outside of school? Yeah. So.
Yeah, it's cool.
I mean, school for us, I have a kindergartner, and it's like, and a preschooler. Preschooler is like laying on the floor while I'm doing her alphabet flashcards and making snowmen or whatever she's doing, or snow angels. And the 5-year-old's like climbing on the table and just doing ridiculous things while we're doing our schoolwork. So.
Yeah. So with going way back here, with the body dysmorphia, what was it that like pulled you out of that headspace?
Yeah, that's a good question. There wasn't really a day where I was like, hey.
Sure.
The Atlas adjustment.
It's finally the perfect Atlas. It had a lot to do with birth. I was also part of an organization called Birth Fit.
Right.
And we did a lot of talk about that. And like starting to embrace the power of my body. I created 3 humans.
Yeah.
Like that's freaking cool.
Yeah.
And so when we hear pre-baby body or whatever it is, that just sends like all of the up my spine, because that body's gone.
Right.
And now you have this amazing baby that you created from this amazing body that still exists. And now how can we optimize it, And so I'm not sure that it was my first pregnancy. I still was like, how do I get back to my, original weight and whatever.
Mm-hmm.
Now I like, after the last baby, I'm like, dang, I just did it. I had a VBAC. It's all natural.
Sure.
Hear me roar, all the things.
Mm-hmm.
And now I just don't care. I just want to be strong and I want to function well.
Sure.
I want to be able to like enjoy every single day of my life.
Mm-hmm. And you it's fair to say you weren't enjoying every single day of your life.
No, not when you have to like, that's bad food. I shouldn't eat it. And that's,
Sure.
I should have worked out for 2 hours today.
Sure.
Like when you're constantly beating yourself up and you don't feel good when you do those things either,
Right.
Like all that stress and all that pressure and eating 2 saltines, like that's crazy.
Yeah. But now, yet, you exercise on a regular basis.
Yeah.
And you eat good food on a regular basis, right? So it's like, how do you now deal with those things, knowing that they were kind of the addictive substance, so to speak, previously?
I guess it's the mindset shift of it's no longer a punishment. It's no longer good and bad.
Mm-hmm.
It just is what it is. Like I enjoy coming here and moving with the other humans that are here.
Yeah.
And I every night at 7:00, I'm really excited to pull up my Wi-Fi app and see what kind of torture we're going to have the next day. And I will say, like, there are workouts. Like, I'm the biggest whiner about cardiovascular fitness.
Mm-hmm.
And when I see workouts that are all cardio, sometimes I choose not to come to those because they're not enjoyable to me.
Sure.
And I don't really want to sit and like say bad things in my head the whole time I'm doing them. So I'm still being conscientious about which workouts.
And like, I think even hearing more of your story, it's like that could be partially wisdom for you, right?
Yeah.
It's like, let's focus more on, not being on the Sarah stepper for 2 hours, right?
Yeah.
But like, I need to actually err a little more on the side of let's freaking lift some weights, right? Yeah, I think that's great. Yeah, that's awesome.
But when I do miss a day, like last Thursday, I had like the worst headache on the face of the planet.
Sure.
And my 2 options, I had just so much time and I could get adjusted or come to the gym. And really at that point, getting adjusted was a much more needed thing than for me to come here and worsen my headache likely and be miserable the whole day and then yell at my kids.
I think what you're describing though is really a vision that we have for everybody, that you would become a different person, that it's not just, like you are a slave to the gym, you're a slave to this diet. It's like you have become the person who, yes, I exercise, right? But like I'm also aware of my whole self and my entire need for health. And the best thing I can do today, instead of going to the gym, is go get adjusted, right? So like yesterday, I'm the guy who owns the gym and tells people to come to the gym and work out. Baby was awake like before 3 a.m. and like I took him out in the car and drove around, and an hour later he falls asleep, and it's like, am I going to work out on 5 hours of sleep and push myself as hard as we do? It's like, that's probably not a good idea, right? Yeah. So it's like, didn't do that, right?
And then the important part is that you didn't sit there all day like, I'm such a jerk for not going to the gym.
Sure.
I am such a loser. That was so bad of me, I'm probably going to get fat or, whatever.
Right. Yeah. Also understanding that it's like, not only is it okay to have some grace in that moment, but also, it's like, it's actually even better for me because I probably would have pushed myself too hard in an already stressed state. Yeah. Basically, I heard, who was I listening to? Basically, they were talking about how we're essentially addicted to cortisol, right? Like, get this huge rush with this high intensity stuff all the time, and in a like yes, cortisol's good, but like if that's all we're doing and that's how we get this boost, like that's a very unhealthy relationship and feedback loop with that, right? So it's like, yeah, I know that I could have gotten through the workout, but it's like that was definitely not the best decision.
Yeah, and then that's some of the thing that I really like about the principles that, I mean, you say them right in there. Sometimes you need to rest.
Yeah.
Sometimes you need to eat ho-hos, you know,
Right.
like my favorite example is maybe not ho-hos. But one thing that like I heard in
Okay, maybe that would be too far.
I mean, I'm trying to connect it to like somebody said this in a birth fit something or other that like if every year during the fair you go and you have I don't even know what they're called, those things.
Funnel cake.
Funnel cake, you guys knew before.
I'm this person you're describing. No, it's
every year you go with your grandmother because your grandmother
Yeah.
loves funnel cakes and it's this like special experience that you get to have with your grandmother and at someday you won't get to have with your grandmother anymore. Like, why would you ruin that experience beating yourself up about eating bad food?
Yeah.
Eat the friggin' funnel cake and enjoy it with your grandma. You
maybe
know?
even a corn dog with it.
Yeah.
Yeah, for sure. For sure. Cool. So I got a couple questions here. How'd you end up here?
Well, ultimately ended up here because your lovely wife is in a business group I'm in. And she kind of heard me talking about core and pelvic floor. And she's like, you need to come talk to my husband. And so eventually that happened. And I love what you're doing here in regards to core. I love that you guys are interested. I mean, all the principles and how you like make them not such strict rules and whatnot. But I do love in class that like I've not seen it any safer for people to come and do functional training than I do here.
Cool. Cool. Yeah. And so what's interesting about that is like, so you come directly from like personal experience with core dysfunction and like the DNS training, like very specific training in this area.
Yep.
And so it's like from my perspective, like, okay, my wife hears you talking about this stuff and she's like, wow, you sound like my husband or whatever. From my perspective, I'm like, we're starting at the place of strength and conditioning and I'm looking at, okay, what is optimal for the human being in these certain realms? And we land at the same places, but it's like, it took a couple of times like of us getting together and me kind of hearing more about like how you're thinking about things for it to click and saying like, oh, we're saying the same thing, right?
Yeah.
So it's cool to like have you coming from just a totally different realm, but like if what we're saying is true about how the human being works and functions, right? Like then there's this massive amount of overlap between where I'm coming from and where you're coming from. That's like, like we jive, right?
Yeah.
And that was a really cool like moment for me to realize like, oh, we really are talking about the same thing here.
Yeah. I think the big thing is like getting to people. Like in practice, it was like, no, why don't you understand me? Like breathe here and do this and do all these things. And people don't live in their bodies anymore. They don't feel their bodies. And so like trying to explain those things, you know, like this morning, I'm like, I saw you trying so hard to get someone in class. So like, I'm like, oh, I can see the frustration and like verbally not being able to, you know, but like not feeling it.
Yep.
So I think that is like a new added dimension of like my practice that I just started doing in the past 6 months is like realizing that, holy cow, I have to come up with all these crazy new ways to get people to feel it.
Yeah. Yeah.
And that takes so much time that, you know.
Yeah, for sure.
The struggle, I think, is like getting people to stay on board long enough to get to the feeling.
Right. Like,
and not get frustrated with the constant like, activate your core, activate your core, activate your core, the repeat, you know.
Right. But it's like, the gym is like this, it's like this testing ground, you know?
Yeah.
It's like most people don't have the awareness throughout the other 23 hours of their day to be thinking about all this stuff, right? And it's like we use the elements of strength and conditioning to throw all these different variables and kind of put you to the test. How do you function as a human being in this embodied being that you are, right? Like, let's throw these different elements at you and use this as a testing ground to like see, okay, you know, when you do pick up this thing off the ground, right? Like, it's a test. Every rep is a test, right?
Yeah. Can
Can you do this? And like, you're doing it in a supervised environment, right? Like, we're this type of thing, you know, it's like it doesn't exist anywhere else.
Yeah,
right?
not at all.
But it's like, I dare I say, near optimal to be able to, you know, like do the test in a controlled way and in an infinitely scalable way, right? To essentially train how to be a higher functioning embodied human.
Yeah.
That's what we're doing, right?
I love it.
Take it to the nth degree with the fittest people in the world, great. But like, we're all on that spectrum somewhere.
Yeah.
That's what we're doing.
Yeah.
Cool.
I was just going to say, so she wouldn't tell people who have had multiple babies or have just had a baby to not functionally move?
Mm.
Oh, absolutely. Everybody moves functionally throughout their whole day. I would just say that there are special considerations.
Yeah,
you know, like if you're in that first 1 year.
Right.
Yeah.
Right.
Then can we do the controlled movement? I mean, I'm probably a frustrating gym goer for, you know, coaches because like I won't do certain things because I know my restrictions. And I started here very slowly and very low weights and very strict form. And I mean, I feel like I've, you know, increased over the past couple of weeks. I actually feel really good in my body right now. I feel really strong and stable. But, you know, starting in that first year, can you do a stable core? Yeah. And can you do it safely so that we don't perpetuate these things?
Yeah, I'm working with somebody right now, and if she's listening, she'll know I'm talking about her. So she's a few months postpartum, and she's got, like, from playing sports growing up, from, like, being a fairly active runner, like, in the past 10 years or so, whatever, like, she's got a pretty big aerobic base, right? Yeah, she can hustle. But like the downfall is not having some of this structure and stability to be able to carry load in many, many, many different forms. So it's like she's got this capacity to go hard, but then like kind of a dragging stability aspect to where it's like, you know, you've got the ability to go really hard and perform at super high level, but when we're doing these deadlifts or these pull-ups or whatever, it's like we can't go hard at the cost of how we're training these things. Yeah. So I tell people all the time is practice doesn't make perfect, practice makes permanent. We are going to like be and become the things that we're practicing all the time, right? So even if you've got the lungs to go harder and faster, I don't want you practicing looking like junk in between point A and point B, even if you get to point B the fastest, right? Yeah. So, yeah, definitely.
And I would even say, I don't know if I've ever told you this, but like when you program 100 pull-aparts, and I get to 37 and I start feeling like my trap is pulling on my occiput, I'm like, okay, 37 is good today.
Sure.
You know, just because if I could do 100, but then at that point, the breakdown has been so much that I will just suffer the rest of the day. And I'm training my trap, not what I'm supposed to be training. Right. And so I'd say even in here, like sometimes we modify, you know, whatever, but like I'm being proactive about my body. And not putting that responsibility on you to keep me safe. You know?
Yep. And it's like,
You can give me the framework.
Right.
But
In the group class setting, it's kind of like we say it's kind of this happy medium between like me being one-on-one coach with you, being able to like be with you, making every decision along the way. Not quite there, but a huge improvement over your $10 Planet Fitness membership where you're just walking in and you've got free reign, right? Yeah.
So Ashtanga yoga is actually a lot like CrossFit in that it's a memorized sequence. Okay. And so you just go in and you start doing your practice, and the teacher just walks around the room.
Cool.
And kind of knows everybody's body and knows kind of everybody what you're doing. And so it's very much the same experience.
Yeah. Yeah. Do you teach that?
I do.
At the...
I don't currently teach classes.
Okay, got it.
I just do... I love yoga. But I just want to incorporate so many other things in, So when I teach a class, it's like, we're going to roll around the floor and be babies and learn core stability, and we're going to pattern a proper, overhead lift. Or we're going to work on some mobility, like true mobility, owning strength in an end range instead of just smashing muscles or stretching the crap out of them. So.
Yeah. Does anybody locally do that yoga?
Yeah, Tapa's Yoga Shala.
Where's that?
Rock Island in the district.
Okay, cool.
That's actually where I took my teacher training, and they're fabulous.
How does that compare to? I know about this much about yoga. I suppose more than the person walking on the street. I'm familiar with yin.
Yin, yeah.
Kind of long holds at end range type of thing. What is a defining feature of Ashtanga?
So Ashtanga yoga is more strength, more power yoga.
Okay.
We're holding things for 5 breaths. So I will say that the meditative aspect of Ashtanga yoga is what really got me.
Sure.
I mean, there's the strength component. So it's not just like, I get to do awesome things that feel strong and amazing.
Yeah.
That's my thing.
Is that where handstands would come into a yoga practice?
Handstands. Cool. My favorite one is Bhuja Padasana. It's a arm balance. So it is a lot of while trying to gain this flexibility, can you activate in certain areas so you're not just hanging on joints and stuff like that. But
cool.
Everything's held for 5 breaths. So you can't be thinking of other things. You're counting your breaths. So I was like, so how amazing is that you are also sort of forced to be meditating while you're moving.
It's cool.
I was just the reason I said the thing about you wouldn't. I was just joking, saying you wouldn't ask a woman that just got done having a baby not to functionally move, because I think that's where a lot of people are at. They would look at or just have an idea of what we do at the gym and say, well, there's no way that I would ever step into that because you just had a baby, or because you've had 6 babies or whatever it is. So I think what you do for sure is a piece of getting somebody to there, but I think even it's just a mindset that's been trained into people that they just don't understand the importance of functional movement.
Yeah.
So they think that, they can just go and...
I think if somebody in the Quad Cities just had a baby and wants to get back to moving, this is the place I would send them. So,
well, there you go.
Heard it here, folks.
Because I know that you all will look out for their pelvic floors and cores. So.
Yeah, and it's something that we're continuing to refine our process of that even. I would say today, somebody comes in, this woman I'm working with now, the process she's going through to make sure that we're caring for her in the best way possible is even more hands-on than the day that you started coming here. We're trying to care for her more right now, and I know that that's only going to increase.
Yeah.
Yep.
Yeah. Cool. This is a fun question. What physical goals do you have for yourself?
Oh, I think I said them before.
Okay, yeah. Maybe more specific than just be strong.
No, not be strong. I think it's I just want every day to be
that's true.
maximized.
Okay.
To feel good, to be able to live them, to be able to enjoy my children. And every day, I don't want to be laying in a nursing home.
Sure. There you go.
With bed sores.
Yeah.
I want to run into my grave.
Yeah.
Okay, well, we know I don't run. I I'm going to row into my grave.
That's good.
Nice.
That's good. No, that's great. Like one of the pictures that we've talked about frequently is this kind of like sickness, wellness, fitness continuum. The more that we can work ourselves towards fitness, the greater hedge we have against ever ending up in the nursing home, right? If I can train you to do 100 burpees in under 10 minutes, the likelihood of you ever not being able to get up off the ground,
Yeah.
next to nothing, right? Like that's the goal.
Yeah. And as a woman, even the, osteoporosis and all the things, can we hedge those things off?
Yeah, for sure.
Can you make it to 70 without taking medications
Yeah.
or not being on a medication?
Yeah. Yeah. I mean, one of the things that I liked about what you were saying earlier is, yes, we want everything that you just said, but also you want that to wear off onto your children, right? You want your kids to be taking that from you so that can continue.
I mean, how cool it is that the two of you and Emily, now have created 6 people who will then likely marry another person and create more people. And so if you want to renew the city, I mean,
that's how it happens.
Yeah.
Absolutely.
So as long as we can continue to hand that down,
Yeah.
and you have 4 people and I have 3 people, and so we're going to have a lot of healthy people if we keep it going.
Yeah.
And that gets back to the mindset question that you asked her, kind of what led you to change that mindset. I think a piece of it is what I've seen in people that I work with, the people that are able to kind of make habits and do this for the long haul are people who aren't necessarily focused on themselves and trying to get to, running to their graves. They're the people who are constantly working at that, but they're also people who are then trying to pass it on to others, whether that's their children or they're just loud about it to their friends and are trying to bring people into what they're doing. Or if obviously you become a professional in this area now, so they find some way of actually teaching this, passing it on to people. That does something in us that just allows us to continue to maintain, what we're doing. So I think that's probably was a piece of, how the mindset changed, because you just became this person who not only were doing it for yourself, but now you're passing it on to all these other women. So that's huge for the mindset.
Right. Yeah. That's like, we're kind of working through, like what does it look like for us to, take somebody, say it's take a person who's type 2 diabetic and they're in the boat of chronic disease, headed for disaster, right? To take that person towards health, right? Like as we kind of progress through and they make changes personally and we kind of pan out from nutrition to our movement to all of the principles and stuff, we kind of realize that it's like the end of that progression is the multiplication factor.
Yeah.
Right? It's that person then being able to take this good thing that they have experienced and take it forward, right? That's that's the end. You've arrived at that point, right? Yeah.
And that's how everything is that you talked about in the beginning is going to change. How are women going to be now educated on not how things have been medicalized, how sitting all throughout your life is going to end up it going bad when you actually want to have a baby. That happens from educating one person, and then they tell somebody else, and you educate them, and then, as you said, it gets passed down into families. That's how things are going to change, over the long term. So this is why that gives you hope, Otherwise you'd be in a pretty miserable state because there is so much bad coming at us. And so many lies that are told out there that prevent people from actually being able to get to optimum health. But I think it's slow, but it can definitely be changed over time, as long as there's more people like you that what you're doing, and more gyms like this. So let's start another one. What are we doing?
Let's make it happen. Cool.
Maybe one closer to the west side of Davenport.
Do you live over West End? I know. That's actually, stay tuned. Stay tuned. Very cool. Sweet. Thank you for being here with us. This is great. We kind of like made our way naturally to that last question, talking about what a How do we become a renewed city? Well, you have more babies and train them up well.
So you prepare yourself to have those
There you
babies.
go.
So obviously,
There you
and
go.
then what to do after you have them.
Yeah.
Prepare yourself to have a baby.
Cool. Sweet. This is great.
Yeah. I got nothing else.
Awesome. Thank you.
Yeah, thank
Yeah.
you.
Thanks.
If you can hear me now, that means you made it all the way through the show, and I have a big old thank you for you. Thank you for your attention. Thank you for listening all the way through. We hope this has been helpful for you, educational for you, entertaining for you, whatever it may be. We really value your attention. What we also value is your feedback. So we would love if you could leave us a comment, leave us a review, send us a message, let us know what you think. Let us know if there's any other topics you want to hear us talk about, if there's anybody else you'd like to hear us interview, or you'd like to hear them talk to us about certain things, whatever it may be. We'd love to hear from you, hear your comments, your suggestions, all of it, okay? On Facebook, you can join our group. It is called Renewing the City. Just apply, I don't know, hit join this group, whatever it may be. You got to hit join and I got to approve you to be in there. But on Instagram, all you got to do is follow. We've got our Principles of Health going up almost every day of the week. Or if you're ready to kind of jump in and really see what it looks like to join us here at the gym, you can go to newcity.fitness/start and schedule time to talk to one of our coaches. Again, we really appreciate you, your time, your attention. Until next time, peace.